who have a history of asthma or allergies may be at an increased risk of developing high blood pressure and even heart disease. Dr. Reena Mehta with the Uptown Allergy and Asthma joins us to explain all of this new information coming out. Down here in the South, so many people have the allergies. I mean, we have so many different greens out here, and then you bring in asthma, but now we're saying if you have high blood pressure or heart issues, it could be a really big strain on the heart. Tell us about that.
So this was a recent study that looked at 30,000 United States adults, and what they found was those in the range of 18 to 57 who had underlying allergic conditions. So that could be things like asthma, environmental allergies, food allergies, had an increased risk of high blood pressure. And we know that when you have high blood pressure, that can lead to an increased risk of heart disease and heart attack.
So is this something that is new in terms of, I deal with allergies and, heart pressure is good, blood pressure is good, but it's something that now we need to really start thinking more about and maybe tell your doctor that I'm dealing more with allergies or asthma, maybe need to, kind of check more things too with the heart and maybe kind of the relationship with that asthma.
That's exactly right. And so what they found in the study, so now, lots of studies have shown this risk between allergies, asthma, and heart disease. And so what this study showed was that if you think about it, inflammation is the key potential triggering factor here. And so if you are having an allergic reaction, your body releases a chemical called histamine. And histamine is an inflammatory mediator that can go to different parts of the body and create inflammation. And so chronic inflammation over time can be bad for all parts of the body, including the heart. And it can cause your blood flow to constrict, increasing your blood pressure and increasing the risk of cardiovascular disease. And so what was interesting about this study is that they showed that if you're in this kind of...
I think we may have lost her signal. Let's see if it comes back, and if not... All right, what we're going to do... Oh, there you go. Go ahead, we lost you. Go ahead.
So what the study showed is that if you're in that age group of 18 to 50 years of age, and if you have underlying allergies and asthma, it's just a signal that you should probably talk to your primary care provider about adding this as a potential risk factor.
Well, is it true that medications taken by people with allergies and asthma, it could have really that impact of maybe heart attack? In other words, we talk about cardiovascular issues, but heart attack is probably the most extreme issue that comes with heart issues. I mean, could allergies actually cause those heart attacks?
So, as you mentioned, according to the CDC, heart disease is the #1 leading cause of death in the United States.
Right.
And so when we think about medications that we take for allergies and for asthma, there is a consideration there as well as could those medications be adding to the problem? And so antihistamines, which we typically take for allergy symptoms, are generally pretty safe. But now, if you add the decongestant, the D part of the medication, that can constrict blood flow to the heart and increase your heart rate and blood pressure. Also, if you have frequent asthma, steroids are something that's typically given to help with your asthma attacks or even for severe allergies. And multiple courses of steroids are also known to increase blood pressure and increase potentially heart disease. So you also have to think about, do I have these conditions? And then also, what am I doing to treat these conditions that could potentially put me at increased risk for heart disease?
All right, so about 20 seconds left. If you do have allergies and you do have heart issues, what do we need to do? I mean, there are ways that we can take care of ourselves and, talk to your doctor about it. But, if somebody does have this, I mean, it's not a fatal issue, but it could be. What do we need to do to really keep our bodies safe and keep them healthy to not have those issues?
So then it's time to think about kind of non-traditional ways to manage allergies or asthma. So that's maybe seeing your allergist and figuring out what you're allergic to, because then making some changes in your environment can sometimes be helpful, and you don't necessarily need to be put on medication. Allergy shots can be really helpful as a way to desensitize you. So basically, if you are an asthma allergy risk factor, if you have those risk factors and you also have high blood pressure, it's reason to sort of think about what else can I do to manage my symptoms. That doesn't mean necessarily taking high-risk medication. And also, early prevention and treatment can be the key with high blood pressure to reduce cardiovascular disease.
Absolutely. It's all about habits and choices, and, we got to make those healthy choices too, and science rolls on. So now this is something more we need to look into. Dr. Reena Mehta, thank you very much, and hopefully people with allergies aren't suffering too much. Out there, everything's blossoming. Take care. We appreciate it.